Fit and Healthy Athlete Podcast.
Debbie Potts is here to help you burn fat, optimize health, and enhance your performance in life as you age. We'll explore metabolic health, holistic health, and actionable insights with guest experts and deep dives into health topics. Whether you're an athlete or just looking to thrive, let's discover how to become your best self. Let's get started.
Hey, welcome to the Coach Debbie Potts Show. This is a show for you if you are a driven, ambitious, high performer who feels that they are doing all the right things but still feeling stuck. I'm your host, Debbie Potts. I'm a former top endurance athlete turned functional diagnostic nutrition practitioner, also known as FDN practitioner, and I'm also a functional nutritional therapy practitioner, as well as a long-time personal trainer and endurance sport coach for cycling, running, triathlons, and I'm also the creator of the Holistic Method coaching program. About 10 years ago, I was pushing my body to the limit, running a fitness studio all by myself. I hit a wall. I had unexplained weight gain, extreme fatigue, disrupted sleep, memory issues, brain fog, all while eating clean and training hard. I suddenly realized it's not just about what you eat or how you train. It's about what is happening under the hood. Now, it is my mission to help people as you, a high performer, to stop spinning your wheels and finally uncover the hidden stressors, metabolic dysfunction, and hormone imbalances that are holding you back from being your best self and living your best life in the second half of your life. So on my podcast and the YouTube channel, I will be sharing real conversations, expert interviews, and data-driven strategies to help you rebuild your metabolism, balance your hormones, restore your energy, and create your strongest, most vibrant future self. So if you are ready to stop guessing and start investigating and wanting to thrive from the inside out, you are in the right place. So let's get started on your journey to becoming your metabolically fit, more resilient, and unstoppable self at any age. So head to debbiepotts.net and schedule a call with me to discover more of my 3 coaching packages. And we can get you started on being your best self in the future. All right, let's get to the show today. Enjoy and let me know your questions, comments, and suggestions. Hit subscribe and share this to other high performers who are struggling to get results when they think they're doing all the right things. But sometimes we just need to investigate what is actually going on and put the missing pieces of their health puzzle together again. All right, talk soon. Enjoy the show. Hey, it's Debbie Potts, and I have an interesting conversation today with Dr. Virginia Marston, and she's truly remarkable. I hope you enjoy this talk. Dr. Marston is an American Board Certified Naturopathic Doctor, a registered Mexican nurse, and a pioneer in natural healing therapies. She has more than 30 years of hands-on clinical experience. She specializes in fascinating areas: neural therapy, membrane medicine, nutrition, family constellation therapy, chiropractic care, ozone therapy, and much more. She is brilliant, and her work is deeply personal. Can you believe she is a mother of 12 children, including her daughter Mary, who lived with an illness, cerebral palsy? And Dr. Marston brings her extraordinary blend of clinical experience and lived her life into her practice. Her journey of caregiving, healing, and a ton of building her resiliency, this all shaped her mission to help individuals restore their health at the deepest cellular and even emotional levels. She is also a sought-after instructor, keynote speaker, educator, sharing her knowledge at conferences and trainings across North America. And today, I'm really thrilled to have her with me on the show. And I wish I could go and experience her clinic, her therapy firsthand. It's called the Luz Wellness Center in, I don't even know how to say it, in Mexico, Chihuahua. Chihuahua. Her team offers a huge menu list of restorative therapies, detoxification programs, and integrative healing approaches rooted in both modern science and ancestral wisdom. This talk is fascinating, and I could talk to Dr. Marston for hours. We talk about healing at the cellular level, emotional levels, how she believes first real barrier that blocks people from healing, and how to help people to overcome it. And practicing neural therapy, a new area I haven't really dove into, membrane medicine, and looking at how she combines all these modalities together to create lasting transformation in her clients. And so if someone's listening who feels overwhelmed, sick, or stuck, listen to what we're talking about today. And hopefully my other episodes on the rabbit hole on building resiliency in the vagus nerve help you shift into healing mode and getting your body back into healing state. You can learn from this, but enjoy this conversation and let me know your questions. Send me a message, coachdebbiePotts@icloud.com. All right. I am looking forward to this conversation as I love talking about detoxification and improving ourselves at a cellular levels. I have Dr. Virginia to come on the show to talk about what we can do today to do whatever we can to be our best self in the future. So we're not struggling as we age, but we are thriving. So I wanted to get some more information from other experts in the field. So thank you for coming on my podcast to help us be our best selves.
Thank you. Thank you very much for allowing me to come. So,
Well,
yeah.
Tell me about what you do. And I always love to ask, why do you do what you do?
All right. So I specialize in detoxification. We have a center, La Luz Wellness Center, here in Chihuahua, Mexico. We have people that come from all over the world to detox. Now, why do I do this? Because I guess when I was in nursing school about 30-something years ago, I assumed that the traditional allopathic way was the way to go. And I tried that path. And during that time, I had a child that had an anoxia and had choked and was in a state of a coma for about 18 years. And just trying to turn to the allopathic world, kind of just, I went to a lot of dead ends and didn't get anywhere. So obviously I had to think about how I could turn to other modalities such as naturopathic medicine, alternative therapies. And it was amazing what I was able to find and how I was able to feel like I was progressing some with that. After 18 years of a lot of work and struggle and trying to figure that out, I realized that I wanted to do a lot more and that we could definitely find ways to help people without having to just turn to the allopathic way. So that's the main reason why I'm doing this, because I was able to see and experience the progress with this with a lot of other people, and it worked again. So I was able to, I felt that my daughter did pass when she was 18 years old. And I was able to open up a center where I was able to get all of the information that I had learned and be able to put it into practice.
So tell me about your center. What do you offer there? I looked at your website, found it very fascinating.
Yeah, there's a lot. For example, it's mainly based on detoxing. So we always start off with, one of our most important things is muscle testing, because we really want to get programs that are very, very specific for the patients. We don't want to assume or just follow someone's protocol. We want to be able to target very specific nutrients in very specific areas in the body. And when you muscle test, you're able to find out where the root of the problem is. Also, we do, I read eyes. That helps me to know where I'm going to get started. We do thermograms. And these thermograms, what they do, they help me target and find out where it is that the issues are in the body. I could see where the toxins are. And then I could just go directly to that area, and we'll do neural therapy, cupping, acupuncture. We use HOCAT, we use plasma devices, scalar devices, spooky, skew. I mean, it's a lot of different therapies. And then that does not include all of the intravenous therapies that we have available. And what's wonderful is that here in Mexico, there's so much more that's available, you know, that they're open to versus, you know, in the United States. So it's been very easy for us to be able to do this. So first, what we do is we detox them by using juices, having them move their bowels, doing colonics, and then target the different areas in the body that need to have like lymphatic drainages or neural therapy, wherever it is that we need to get into, like ganglions or different parts of different organs that are struggling to dump their toxins. We work with that. We also, what we have seen, probably the most difficult thing to work with when you're trying to detox, especially on a cellular level, if you cannot get your liver, gallbladder, and pancreas, and even kidneys to clear up, then what will happen is that when you're trying to detox on a cellular level, you'll start releasing toxins, and then that's where the herxine, that's where all of the histamine, all of these reactions take place. And we found that if we can first open that area, all the pathways of elimination, then we're able to successfully detox someone on a cellular level. So
yeah, so I think so important. People don't understand the importance of opening up the drainage pathways before they start doing any detoxification program or parasite program or any protocol, because you have to have the freeways open so there's no congestion along the way, no blocks. And I think a lot of people backfire when they start doing something as this before they have everything developed.
And they get discouraged.
Yes.
They get discouraged because they don't feel good, and they don't understand that you can't go in for, I say, for the kill, you could say. You can't, because if let's just say you kill a parasite. Well, the parasite that's been collecting heavy metals and chemicals for a lifetime, as soon as you kill the parasite, it needs to be eliminated. And I mean, within a very, very short time. We make sure that our patients have about 3 to 5 bowel movements every day, because we're giving them intensive parasite detoxers and killers. So we have to eliminate that quickly. Yeah. And again, a lot of the patients that have severe parasitic issues, they don't use the bathroom. They don't have bowel movements the way they're supposed to. Ones that get serious trouble. So we could see that a lot of people will start chelating, heavy metal detoxing. They'll start doing the parasite treatments, and then they'll start struggling, because a lot of these parasites, when they die, they decay, and then they release all these heavy metal and chemicals right back into your system. So you're just recycling and causing all this havoc when you could just figure out a way to eliminate it instead.
Where did you get your training to learn more about this holistic approach?
Ooh, so I got a naturopathic degree here in Mexico. I've got my nursing degree, my RN here. And then, of course, I have to tell you, I mean, most of my work I learned mostly everything with my daughter. I mean, being a mother, and a desperate mother to find answers, to see your child feel well, I mean, you'll do anything. And I could go to a class, and I was a sponge. Because I could connect the dots, and I understood how it worked. So, of course, Dr. Cleanheart, he played a very important role. Since 1992, I've been taking his training. I've been following him. Dr. Patricia Kane, she's like the pillar of strength that I had, because she helped me with the phosphatidylcholine to be able to get rid of my daughter's seizures. I mean, I've had the opportunity to meet so many iconic figures that played a very important role in teaching me and training me.
Hmm.
So
Yeah, that's amazing. It is an ongoing journey to continue learning,
yes.
I know. And once you get in this area, there's just always something we start thinking about and putting the pieces of the puzzle together and go, oh, wait, how does that work? And
Yes.
going a little bit deeper, right? It's just never ending.
Yeah, and
The
right when
rabbit
you
holes.
think, yeah, you think you might know a thing or two, and then you're like, whoa, I never thought about that. And really, even when patients come,
Yeah.
I mean, I've been doing this for 37 years now,
Wow.
and I have seen a lot. But
Mm.
there'll be patients that come that'll just like, whoa,
Mm-hmm.
okay, I love challenges. I do really good under pressure. And I love learning. Yeah.
Yeah.
So, and I always tell my patients that, I'm willing to work just as hard as you, as long as you do, as long as you're working hard, I'm going to
Yeah.
work hard along with you, and we're going to solve this. So,
And that's a big part of the journey, helping people is helping them understand that they need to do the work. And I think this is the biggest hurdle for us to help people shift and get the results they're looking for. It's the mental mind shift that it's not just
yes,
here's some supplements and you're going to be better in 3 months, 4 months, or 1 month. It's just understanding how we have to rewire the nervous system. We have to repair and rebuild the cell health and the liver and all the organs and everything that got to be dysfunctional, but it takes time. It doesn't come in a pill. There's not a
that's
medication
right.
to fix it all. We have to do the work.
Yeah, and I think that that's the most when the patients get here, I try to tell them, because they'll hear all these amazing stories. I'm like, wait a minute. Everyone is different,
Mm-hmm.
and there is not that one magic pill. It doesn't exist. And we live in a different world now. We're being exposed to toxicities and EMFs and so
Mm-hmm.
much more than ever before. And I tell them, you don't just go home and eat organic, clean food and have a healthy lifestyle. You need to detox at least 2 to 3 times a year. For example, myself, I do 2 to 3 times a year. I demand a lot of my body. I travel a lot. I work a lot, very, very long hours.
Mm-hmm.
I have 37 grandchildren and a great grandchild, and I'm always going. I've always had things to do. So if I want this body to be able to keep up with all of that, I have to take good care of it. And detoxing and keeping those pathways of elimination open all the time is the way to go. And we just have to accept that. I tell people,
Yeah.
you just need to accept we live in a different world. It's different now. So,
Mm-hmm.
and then once they get that, they get they understand that, then they're able to understand that it's their choices. It's their just, where they go, what they do, what they eat. And they are in complete control of that. So a lot of times they're like, well, always somebody else's fault. My mom, my
Mm-hmm.
dad, my this. I go, no, honey, that doesn't work anymore, because
Yeah.
we're adults now, and now we get to take over and control our lives ourselves. And isn't it a beautiful thing,
Yeah.
And again, I too tell the patients, I will only work as hard as you do,
Mm-hmm.
and
That's
I'll
good.
be right by your side all the way through. But that's the way it
Yeah.
is.
So talk to us about what would you say is detoxification? And then we'll get into
Mhm.
how do you know you need some support?
Okay. So number one, obviously, when you're weak, you're tired, you have all your symptoms, your poor digestion, brain fog. And I mean, I'm sure there's so many more symptoms that are out there. When we're detoxing, we have to know what's keeping your body from eliminating, from detoxing. And as crazy as it might be, it could be a scar, a significant scar. It could be a tooth infection. It could
Mm-hmm.
be an emotional trauma. It could be a spiritual trauma.
Mm-hmm.
It could be so many different things that when I first do an assessment on a patient, and why would I waste so much of their time if I could see that they are struggling on emotional or spiritual level? We'll just go right in and do the work. We'll do a family constellation, let's say,
Mm-hmm.
because if we have a patient that is very advanced, let's say in ALS, cancer, Lyme, whatever it is, a very advanced patient, they don't have a lot of time. So I used to work with them and then realize, oh my gosh, this person is already on a different level. They've already decided they're going to go. So what I'll do is I'll just do a family constellation. In the constellation, I will know what they're entangled with. Can we disentangle that? Can we set them free from that? Are they willing and are they ready for that? And once we could see that, and sometimes they'll just say something like, no, I'm not going to. So in the constellation, and I'm like, okay, then I'll tell them, oh, I think it's best that you find another place because I need all of you, even on the spiritual level, even on an emotional level. I need all of you to be ready to heal. And if you're not, I have to respect that. And I don't want to waste your money. I don't want to waste your time. So we'll go into that. And then again, let's just say a person comes in and immediately I see a tooth infection. So even if somebody sends me a picture of their eyes, it takes me 1 second to know what the root of their problem is. I don't need any labs. I don't need anything. Once I'm able to see that, why would I go and do all these labs and do all this other work when I could see, oh my gosh, this is a massive tooth infection. Oh my, so immediately we schedule an appointment for them to see a dentist, to bring a panoramic x-ray or do a cone beam scan, and then just go straight to that. And if you take care of that, so many of their symptoms automatically go away. So again, we could do it the long way, the really expensive way, make a lot of money. It's not about that. It's not about that. You get to the root of the problem. I love the way that you even talk about it. I mean, we're on the same page because I totally get that. And you will save so much money, so much time, especially with muscle testing. I mean, why would we give them a parasite treatment if we don't even know what parasite treatment they need? Yeah, a lot of people have, we all have parasites, but exactly how much of the dose are we going to give them? How often? For how long? And do they still need it? So all of these things are so important to understand because it saves you time and money.
Yeah, I was trained to do lab testing right away and then, work on the foundations while we're waiting for lab results. But now I'm finding just wait a little bit. Let's work on the breathing. Let's work on the morning sunlight. Let's manage your stress. And then if we don't see a big shift and we're like, oh, we still need some more information, maybe then let's get a GI test and look at organic acids or a mold test. But it's really interesting how so much can be fixed or improved and symptoms can be reduced if we work on just you. How do you show up to life every day? What's your mindset? Are you getting outside first thing in the morning and seeing that sunlight? And it's so amazing when you dive into the why of everything, how the morning sunlight helps your sleep and how the breath work helps that vagus nerve and feeling safe. And it's just so much we can do is just making those little shifts and creating new habits. And then you might feel a lot more better
You're
after
absolutely
those.
right.
Yeah.
And you know what? A lot of times patients will say, before I get there, what do you want me to focus on? And I'm immediately, let's take care of the diet. Let's get really good, lifestyle habits in. What time do you get up? What time do you go to bed? Do you spend any time? Here is so important for us. We have balconies where we send the patients out. Okay, you get your timer, 15 minutes in the sun, go ground on the grass. We don't have any pesticides. Everything is super clean. We have scalar devices to protect us from EMF. We don't have Wi-Fi. Get out there and ground yourself. And all those little details, you're absolutely right. All those details really add up to something big.
So if someone has, you said eye issues and you said dental, we did 2 podcasts I've done with a holistic dentist, Dr. Michelle Jorgensen, found that super fascinating. But how do you know if you're looking at eyes, if it's not a mold biotoxin area versus?
Because when you're reading someone's eyes, iridology, when I read someone's eyes, I could see if it is a physical, like let's say the eye itself, vision and so on, you can literally see if there's been a head injury that's interfered with the energy that the eye is getting. You could actually see if in that area, if there's a deposit of toxins. Sometimes it could be mold, and then you could also see in the nasal, in the sinuses, you could see if there's congestion because it's visible. And of course, we always make sure that before we try to get to any type of mold issues, sinuses, we again start clearing up the liver, opening up the pathways. And then we do use the ozone in the nose. We do a lot of the therapies. We do the injections. We do from prolozone, PRP, pretty extensive work, that is used and able to help us achieve our goal. Because as crazy it is, if we have patients that have parasites in their brain, we've actually seen that once they've spent, it takes a while, it takes almost a month, but then we'll start pulling their parasites out of their ears. You'll pull them out of their ears. We've seen parasites come out of people's nose, vomiting. I mean, you name it. We have a collection that'll thousands and thousands of pictures of things that you would never in your wildest dreams. We have stones, because we do colonics, right? So, and I want to talk a little bit about colonics. A lot of people think that they just go get a colonic and there's 40, 50 minutes in the colonic and they're out the door. A colonic to me is a totally different, I use it in a different way, because the secret to a colonic to me is the preparation for the colonic. And then while you're in the colonic, we do a lot of different things while they're in the colonic. If they need emotional work, we'll actually line up dolls and do emotional work in there, like doll therapy. If they need special glasses to help them bring information from their subconscious mind to their conscious mind so they can let it out, so that they can let it out, if you know what I mean, that's needed. Wow. So, and if we need to do neural therapy, if we need to do sonic wave blasting, because sometimes stones are really big and they can't come out from the ducts. So we use sonic waves and we dissolve them in the kidneys and in the gallbladder or wherever they need to be dissolved. To enable for the body to release them, then we go ahead and do that. Because, people really suffer a lot trying to get rid of large gallbladder stones, because they feel nauseous, they get headaches, they go through depression, they're not absorbing their fats. I mean, who knows how many years those stones have been obstructing. And since they're not allowing you to have access to enough bile, you're not absorbing the fats that you need, and then you get all the hormonal issues going on. And so I always tell people I kind of sound like a broken record, because I'm like, take me back to the liver. If it's hormonal, take me back to the liver. If it's wherever you go and wherever you want to, and again, unless it's an emotional or a physical impact. If it's an emotional, let's just take care of it on emotional. If it's a physical impact, let's say you had a head injury. This head injury slowed down the circulation into your teeth, and you ended up having cavitations through your entire jaw. So you don't just want to take care of the cavitations. You need to break up all the fascia that's been blocking that, because what's going to happen when you go to heal from this cavitation surgery? You're not going to heal the way you need to, because you still have the blockage. So we go in and we find out, okay, what is it that you need? Do you need cranial work? Do you need adjustments? Do you need prolozone? And then we just go directly to that and open up the energy there. And then we'll do all the lymphatic drainage, and we'll get their body ready to do the cavitations. And then they heal beautifully after the cavitation surgery.
Wow. Okay. So I have a few other notes to go into, but going back to the parasites coming out there, how do you think the parasites get all the way up into their brain?
I dare to say most of them do through cavitations. Most of yes, cavitations. I literally have seen when there's a cavitation surgery where they open up and parasites they're just trying to put them into the little container to go get them tested. Oh, I've seen this with my own eyes, and dozens of them come out. And most of them are the ones that cause psychosis, depression, anxiety, and then there's the ones that cause cancer. Because to me, again, cancer is parasites. And I mean, I've been saying this for many, many years. Why? Because if you look up the word in the dictionary, what the meaning of parasite is, it's a pathogen that lives off of a host, period. What lives inside of you, that's living off of you and your nutrients in your food and your blood and so on. We do live blood cell analysis. We could see the level of parasitic infections that they have in their blood. You could see how a lot of the cells are already dying because they've been infested. So people become very anemic, very tired, very weak. But again, it's parasitic. So again, if everything that's living inside of us that's causing our illnesses, whether they be infections, let me give you an example. I had a woman come in yesterday and she has an infection on one of her ovaries. And I tried to explain to her, I said, okay, then we need to do a parasite treatment. Let's clean your liver out. Liver very, very swollen, very, congested. And I said, let's clear this up, get you on a parasite treatment. She says, no, you don't understand. I'm here because I want to get rid of my infection in my ovary. And I said, okay, let's start from the beginning. I mean, let's clean up the environment. Let's clean up the terrain so that these parasites don't have power over your body. And literally, if you clean things up and open up pathways, they get weak, they get tired, and you can kill them. I mean, usually when we start a parasite treatment, on average between 9 and 12 hours, we will see things coming out of our patients. And I'm talking every day, some up to 5 feet long. We've had 5 feet long parasites. Crazy stuff. But again, we're in an environment where we're doing this is intensive care. This is not, little things. We want to see big, huge stones. We want to see the sand that comes out when we dissolve the stones in your kidneys. I mean, people will urinate sand, men and women, when we're blasting the kidneys and allowing them to break the sediment so that it could get released. Wow. I want to see things. I want to see things within hours. So,
interesting. So going to the liver detoxification, you mentioned elimination. So are you focused on liver health? Are you addressing phase 1, phase 2 detoxifications, phase 3, and in a different manner?
Yes. Actually, and I usually have a chart and I just show them once we clean, this is phase 1. Once this liver is cleaned up and you could see all the stones and the sand in the liver and so on, we can achieve that on an average of 5 to 10 days. But again, because we use very specific frequencies and we call it blasting. I mean, it's loud. It literally dissolves things. So that's the first phase. Once we've cleared that up, and because we'll have patients that come in that maybe have a bowel movement a week. Sometimes I've had a patient that has 2 bowel movements a month. Yeah. And when I started their treatment, that was rough because all the parasites didn't want to go that way. They wanted to come this way. And we're talking bowls of parasites. So yes, and I have the footage. So they'll come out. They want to come out. They don't want to be there anymore because that environment isn't for them, especially if you're being bombarded with frequencies that tend to get your cells and make them vibrate on a different level, on a level of peace, of light, of, they don't like that environment. So that's the first phase. Then we go into the parasite phase. Once the pathways are open, then we go into the parasitic. And then once we see that the liver is soft enough and there's zero pain, because we're always in a lot of tactile, it's really important to feel what the liver is like. Once we're able to see how soft it is, there's no pain. Usually patients, when they come in, we can't even touch their liver. They're like, please don't. There's just so much pain there. Once that's soft, then we go into the parasite treatment. And that, again, takes from 5 to 10 days. And right when we get started, immediately, you'll just see tons and tons of parasites. I've had a patient lose one time, this is only one time because there was so much edema, but lose 100 pounds in a month. But that was of just the biggest parasites I've ever seen. I've never seen anything. I mean, they looked like octopuses. And we've had, and generally, we'll see a lot of people lose a lot of weight, mainly from the abdomen and from losing a lot of parasites so quickly.
What is your parasite protocol then? You have different, all these modalities. Muscle test, but you have the different treatments.
We have about 30 different bottles of mimosa, artemisia, ivermectin, fenbendazole, endless. Yeah, a lot of different combinations. And then we just ask them, for how long do you want this treatment and how many pills? And then we'll do 2 weeks. And the patients, after 2 weeks of this, if they're admitted, we keep track of them. And sometimes we'll try to incorporate another one. And then if a patient is an outpatient, they come back in 2 weeks, and then we muscle test them and see where they want to go. I will tell you, I'm very, very careful with this parasite thing. I have, again, because of the experience that I have doing this, I always start with the most benign, and the body asks for it. It's not, I've just seen this. The body asks for the most benign, for example, herbs that are not so aggressive. I almost always start with mimosa and artemisia. They're very benign. You can take the whole bottle, nothing's going to happen to you. There have been women that are pregnant that didn't know they were pregnant and took it for a while, did great. Nursing mothers do wonderful. And like that, but I don't recommend it. It just happens to be that they didn't know and they were on it, because I don't ever want to give anyone an excuse for anything. So I'm very, very careful. But once I've been able to clear up the liver, get things moving with the mimosa, the artemisia, they're the ones that get rid of the big, big parasites. Then I'll do the ivermectin. They tend to test for ivermectin. Remember, ivermectin opens up, it goes to the brain barrier, brings in all this trash, and then you have this, it does great in one way, and in another way, it could really mess you up. So you want to just kind of know when it's time to go down that route. And we do a lot of also intravenous therapies that my goodness, will they kill? Of course, because we use the artesunate intravenously, the CDS, ozone. There's a lot of different therapies that you can kill parasites and bacteria in the blood.
Wow.
And that is important, because a lot of times what we have seen, especially with cancer patients, is that you want to be really careful so that the parasites, because that's what actually is metastasis. Metastasis is where, the parasites detach and go and build another nest and start creating tumors in different places. So what we do is, through the entire therapy, we're constantly killing or alkalinizing or feeding the body the bloodstream where parasites can't exist, making it so that they will die, so that they can't go and mutate elsewhere, because they like to use the bloodstream to travel.
So crazy. So I was also curious about the frequencies. You mentioned the light frequencies. Are you using? And
so we're using go ahead.
Well, the rest of it was, is there correlations of using frequency to move things, and the correlation to what you hear about the moon, doing the full moon parasite?
Very, very, very. All of our parasite treatments automatically say that you double up on a full moon.
Because parasites are more active with the light?
Yes, 3 days. Yeah, 3 days before and 3 days after, they double up their doses on a full moon.
Because
yes, we see that, of course, they come, they mate in your digestion, they come out in the anus, they cause all kinds of emotional, honestly, even animals. Look at animals, how they act. Animals that have never attacked anyone. If you ever hear about these attacks, almost always pay attention to the full moon. I always tell all the parents, if your child, because a lot of, I wonder if my child has, parasites. I wonder, and I'm like, okay, find out on a full moon, are they cranky? Are they not sleeping well? Are they squealing in bed? What's going on a full moon? And then just know 100% of whatever it is because of parasites. So you do a parasite treatment.
Are they more parasites are more active during a full moon because why?
Because they're mating, because
of light? I mean, how's that with the light of the moon?
Well, according to what I understand, the moon changes. The moon itself changes. That's why women tend to go into labor during the full moon, because it changes the atmosphere changes, and our nitrogen in our body actually changes. It lowers. There's a lot of chemical reactions that take place that I don't understand, but I do know that when they're mating, they become aggressive. There's a whole entire battle. Well, we know what it's like in the animal kingdom when they're mating, the fights and everything that takes place. Also, I I know that because there's so much changes with the full moon that in reality they release a lot more chemicals. They release a lot of their toxins in their waste, and it affects the person a lot more than it would if they weren't in Meiji.
Mm-hmm.
But
Well, as I
it's like trying to explain why does a woman tend to go into labor on a full moon? You know what I mean? It's
yeah.
like, yeah, but we know at least in a pregnant, because I used to deliver babies, that the pressures would dropping their nitrogen levels and triggering off um, labor.
Hmm. Well, as I warned you, I always like to know the why. So I just was curious. Like, okay, but I'm so fascinated by the mood and moving. I moved from Seattle to San Diego 5 years ago, and we have these king tides, and when they're super high, super low. So I'm always like, okay, wait, how does that happen? How does the moon impact the, start to learn about the tides and how your full moon impacts the parasites. And it's just going into how does this all work in nature and how we're all connected. It's just crazy when you start to
To
understand.
me, it's fascinating. Yeah, it's fascinating. I know that, for example, because I'm from also San Diego, California. I grew up between San Diego, California and Baja California, Mexico. So every so often we would go grunion hunting. Did you ever do that?
No.
Oh, you need to. Well, I don't know where you live now, but you need to. It's awesome. Well, in Baja California, up in the United States, we never did that. In Baja California, when the full moon would come out, you literally could go to the beach and have a bucket, a 5-gallon bucket, and just stand there, and all the fishes come over. Again, what are they coming for? To breed. Isn't that interesting?
Yeah,
They're coming to
that's
breed.
crazy.
And you can literally get a bucket and just get the fish and fill up a bucket full of fish. And they're called grunion. They're little teeny fish about this big. And you tell me, I would love to know. So if you know of someone, I'm all in, but there's something about a full moon,
I know. So that was one question. Then the other topic I've been diving into a lot, understanding how the vagus nerve and detoxification, but the lymphatic system and the fascia and how it all works together with bile flow. And what is your take, since you do so much detoxification work, on the role of the lymphatic system and fascia?
Okay, so when I look into someone's eyes, I could see if they've been in a car accident or have had a major head injury. Now, what I actually have this chart that I show the patients because they're like, I don't understand. Why can't I have bowel movements? I mean, I'm eating perfect. My whole life I've eaten organic. And right away, if you could see that their jaw is out of alignment, their atlas axis, the entire neck, when you have this out of place, your jaw, your teeth are crooked, just know that you're going to have a certain level of fascia impacting the vagus nerve. And if you pay attention, even like, let's say people have big, huge tonsils, they have toxic thyroid, and you'll notice they'll tend to have like this little what would I say, little pouch here. They'll tend to have pouches here, but these pouches are all toxins and inflammation that cannot be eliminated through the lymphatics. So that's why neurotherapy is really, really important, because if you want to go in and start releasing the toxins in the waste here, there's an injection, a neurotherapy injection that we do that goes all the way up into the adenoids. And the adenoids, or the scar tissue from the adenoids, because a lot of children get them removed, or they used to back in the day. And there's all this inflammation. And sometimes when you go in with a needle, you actually feel like there's this huge obstruction there of almost like this jello tissue of toxic waste. A lot of the patients, they have to get to this point. You don't just go in there and do that. You have to be ready. You have to have everything drained, make sure that you take care of the cavitations and so on. Because when you release this, you better be ready for dumping big time. So a lot of times when the adenoids, when the tonsils and the thyroid are inflamed, you're going to have constant pressure being put onto that vagus nerve. And inflammation all the way around it. And remember that right around the vagus nerves, there's all of the nerves that go into the trigeminal nerve, that go all the way into the tonsil, the thyroid. All of these nerves are inflamed. And that's why these people that always, you just touch them and everything is tight, everything, they always have headaches, they have pressure in their head, shoulder pain, so once you're ready to go in there and create that release, it is incredible what happens to the brain and to the body, because it's able to release that.
So what about people, if they have all that pain? I know a lot of people have had traumatic brain injuries, concussions, and how that can impact their detoxification, but also connecting that you're talking about the nerves running through and compressing onto the vagus nerve. And how does that impact their sleep? So many people seem to have sleep issues, sleep apnea, needing a CPAP machine.
I dare to say that at least 80, 90% of the people that have had these head injuries will eventually have issues with their sleep. Without a fail. There's another thing that's really important, is that if you actually have head injuries inside, you do need to go into the scar tissue and break it up with neural therapy. But yes, absolutely, it does impact that. And you have to find out what it is that actually caused that. You've got to find out whether, again, it can be a tooth infection. A lot of these nasal infections, a lot of the tinnitus, all of these things have a lot to do with the way that the cavitations, and a lot to do with the alignment of the jaw. Because again, the alignment of the jaw, I've actually seen patients that have their jaw, their lower jaw, so far pulled back that it's directly pushing into the spinal cord. I mean, that's really significant. So again, it has to do with alignments, that has to do with cranials, has to do if you want to go in there and break things up with neural therapy. And again, I know you had mentioned something about ozone.
Yeah, but sorry,
Because
a long list of questions here. But before you do that,
prolozone is one of the most miraculous therapies that I've ever seen to break up the fascia around the occipital area. It is truly amazing. I mean, I've seen miracles overnight from just using prolozone.
Can you explain what that is for people?
Oh, sure. Prolozone is, for example, we'll find out which vertebrae is being affected, or where the fascia is being compressed. Then we'll go in with a needle, again, depending on where it's at. Then we'll use a cocktail. So a cocktail could be different things, but it's mainly like procaine, Traumil, which is a homeopathic to help heal the tissues. And what's beautiful about Traumil is it also helps heal the emotional aspect of the injury. We'll use like B12. So there's this whole cocktail of about 10 different things that we use. We put that in there. Then if the patient chooses, or if we muscle test them and their body wants PRP, then we'll draw the blood, remove the stem cells, and inject the stem cells in that area, and then we'll follow it with ozone. And it really, I mean, I've had these therapy done, and 5 years of struggling with my neck, 5 years of struggling with my knee from an injury overnight. I got it done around 12 o'clock, and I went and danced all night. And I wouldn't have never been able to do that because I had so much pain in my knees. So it really is a very effective way to help heal and get energy to the area where the vagus nerve is, and also open up the circulation. Think about it. When everything is inflamed, you probably already know this, but your entire spine is straight according to the organs that are attached to it, right? So let's just say that your liver is twice its size. So what is that going to do? That's going to pull up the ribs and flip the spine out of alignment. So if it's very much the same with your neck, that's going to, if you have inflammation in there, you're going to not be able to keep things in alignment. because you get adjusted and they'll go right back out of place. And this is, so for example, with our patients, once we're finished removing all the toxins out of the tonsils, the thyroid, and drain this whole area, then we send them to get aligned, and then we do the chiropractics, and then we do the cranials, because you're wasting your time. Honestly, you get sometimes people only get like 1 hour relief. So we always, and because if you understand the way that the intestines are connected to the entire body, you'll know that the transverse colon is connected to all of this. So let's just say that your transverse colon is completely congested, even the area of your liver, gallbladder. This directly is influencing the way this is here. So if you want to remove the waste and the toxins from here, make sure you clean this up first. Because if you look at the way iridology works, you'll see that the transverse colon has nerves that are directly connected to your brain. All the different parts of your brain, it's connected to your teeth, your neck, your jaw. So you work with this area, because sometimes patients don't have enough energy in there, and they'll have different issues in their large intestine. So you've got to take care of that first, and then go into this area. And that's why, as you were saying, the phases, it's very important that you follow the phases. You don't just go and get prolozone done. I highly recommend that it be done if you want to get really, really good results. You start it the right way, because you want to clean out the intestines, you want to clean out the liver, get everything moving, so that when you open up these areas, your body's able to release whatever toxins have been settled. Remember that the toxins only go to the part of your body where there's poor circulation. Parasites only go to where the toxin is. So the toxins are always in a place where there's poor circulation. So it's important. And when we're muscle testing on a daily basis to find out what a patient needs here, we're always muscle testing the different parts of their body, because we will not leave anything blocked, because then we won't be able to detox as efficient as we'd like them to. We don't want, so for example, let's say you have thyroid issues. Well, we drain, open up with neural therapy, and then you do the intravenous therapy and open up the pathways into the thyroid. And because if you're trying to get to the thyroid and everything's blocked, there's no circulation, I mean, it's very congested in there, you're not going to get much in there. So you have to know how to get the nutrients or the therapies to go into the bloodstream and into the specific organs that you need help with.
Wow, fascinating. Makes sense. And it's such a good, interesting, different perspective that is, as I look at a holistic approach to how to get the body working all together to create metabolic harmony. And it's taken it from a different lens and how everything's connected. A couple different definitions explaining what the neural therapy is, and then explain ozone therapy for people who aren't for sure what you're talking about.
Okay.
So neural therapy.
So now when you're doing neural therapy is it's using, like, for example, we use procaine. Many, many years ago, they used to use lidocaine, but they found that lidocaine has toxins in it that feed cancer. So we don't encourage that. We use procaine, and we also can combine it with homeopathics like Tramiel, like Lymphoso, depending on what it is that you want to achieve with your neural therapy. And what it is we inject approximately 0.5 cc in different points. For example, different meridians, different trigger points where you want to release tension. So that's what neural therapy does. It goes in and you inject the substance in, and immediately it just opens up the circulation. And it's also a vasodilator. So what does it do? It opens up the blood flow, it moves things. So let's just say you've got a lot of toxicities. Let's say your thyroid is full of heavy metals and mercury or whatever. You want to go into that area. It's going to open up the circulation and it's going to dump. So you want to have your binders on board. But again, that's what neural therapy is. It's opening up circulation where there's very poor circulation, by causing the vasodilation and circulation into those areas by releasing tension.
Interesting. And then ozone therapy, to explain that a little bit more.
So now ozone therapy is yet another way to get oxygen into the body, right? So now there's different ways. You can use it intravenously, you could use it rectally, you could use it nasally, vaginally, anyway, wherever there's an entrance, you can use it there, okay? So now the whole purpose is to get oxygen. When you get oxygen into your body, it automatically alkalinizes. All illnesses, all pain, all tension is an environment of acidity. So as soon as you put ozone in that area, you're going to alkalinize it, you're going to take pain away, you're going to release tension. So that's the goal. Why? Because toxins get mobilized because the energy is moving, the flow is moving. Toxins get mobilized. Pathogens, they don't like that. A lot of them end up dying. They only want to be in an acid, poor circulation area. So when you get ozone in there, you immediately create a shift. And again, that's why some people, when they're really toxic, they have to be careful because they can hurt, because it does kill and it does mobilize. So you always have to have your binders on board and know how much to give, because there's just different levels of gamma, which is the dosage, right? So you just have to have a good understanding about how that works. But it's the whole purpose is to get energy, to get oxygen, and to get alkalinity into your body.
And then with the stomach organ, we want that acidic because that's usually killing off bugs. So we want the pH of the stomach to be 1.5 to around 3. So those who, you want the rest of it to be alkaline, but the stomach is, I'm finding this a pet peeve that all these people are on antacids and PPIs. That's like, okay, let's look at the root cause of all your health problems might be starting from mouth to stomach.
No, you're absolutely right. When you're trying to break down and digest food, you absolutely have to have your hydrochloric acid. And the more acid, the faster it breaks down. It kills pathogens. You know, it helps you absorb your foods better. It's amazing. But if you don't have that, and these are for people that when they're eating their food, when they have a bowel movement, they see pieces of their food in there that they can identify. That should be the case, but that's because they have low stomach acid, and it makes a very big difference. But here's the key to understanding. Once the food has left the stomach, the chyme has gone into the small and into the duodenum to go to the small intestine to get absorbed. Immediately after it leaves the stomach, it has to be neutralized. Your stomach has a totally different type of lining than your small intestine and large intestine. So if that acid goes into the small intestine and large intestine, it will start eroding. It'll start damaging the lining of your gut. It'll do the opposite of what it's supposed to do. So because we have our liver, our gallbladder congested, our pancreas congested, also the bile is what, like 9-10 alkaline. The pancreatic enzymes also. So what do? They go in, they meet with the chyme that comes from the stomach after being broken down with hydrochloric acid. It immediately neutralizes it. And then you've got the bile and you've got the pancreatic enzymes that go in and they aid the digestion and everything goes smoothly. And that's why a lot of people, when they eat food, they're like, oh, they feel like their tummy's on fire. Why? Because they're congested, their liver and their gallbladder are congested and they're not producing enough of the bile and pancreatic enzymes. So it's damaging their intestines because of the acid is so strong. I mean, that should be able to dissolve a nail. That's how strong it should be. And again, there's a time and a place for all of that to work, because if it's not done in the proper timing as well, I mean, you can't just always be releasing hydrochloric acid. Imagine what'll happen, how miserable. So you've got to have all of the organs clean and ready to go. This is what it's really hard, especially because I work with a lot of the Hispanic and I work with a lot of Mennonites, and the men have a really hard time understanding what I mean by detox. You know, they're like, you know what, we don't know what that means. What does that mean? And I'm like, okay, your tractor, your truck, when that light goes on and it says you need to change the oil, what will happen if you don't change the oil? well, the engine will just break and it won't work. I'm like, well, your engine needed to have its oil changed a long time ago. And then they're like, okay, I get it. So sometimes you have to go there with that.
Yeah, I know with the men and women, I find it's the more simple analogies, people are like, oh, I get it now. And it helps to just make it simple as the engine light on your car or tractor. So if people are interested in meeting with you, talk about where to find you and how your program works in our last few minutes.
So yes, you would be able to contact us at La Luz Wellness Center on our website. There's a phone number and a contact information there. Usually what I do is when a person is interested in coming, I always ask them to send me a picture of their eyes, because once I see their eyes, I could see the level of toxicity. In their liver, I could see if the stones are too big, and I'll know that. There's you could do a lot at home, so that in a very beautiful valley, very quiet, peaceful, no EMF, no 5G. It's amazing. But sometimes, especially if people can't afford to come, I encourage them to do something at home. But when the stones are too big and they've already tried cleansing, they're always throwing up, they get headaches, I'll tell them, hey, just you need to come in to get this done the right way. But when I can see that there's large stones, then I'll have an idea of how long they need to stay here. Sometimes patients have 4 weeks to 2 months. It just depends on what their diagnosis is, right? So once they've been able to reach me, I'll make a suggestion as to what they need. I'll let the manager know, the accounting, and then they contact them. They let them know what days are available, what rooms are available. There's different packages that are available, from very advanced cases, and then from those that are they just need tune-ups. Okay, so and then they're able to schedule a time to come in.
Sounds amazing. I think, yeah, for sure, once a year, we all need that. Ideally quarterly, but sounds very therapeutic and effective, because you're personalizing it with the muscle testing and all the different modalities.
Yeah, and what's beautiful about it is that those that need the most help are the ones that have the largest stones and the blockages that they'll try doing flushes and they struggle a lot. But once we're able to break through that, they could follow up the rest of their life at home without having to come back. I take pride in the fact that my patients don't come back. I want them to go home. I want them to be trained enough, educated enough to where I got all the hard stuff out that took 20, 30, 40 years to get there. And then they can go home, and once or twice a year, they could follow up and hopefully keep their selves healthy. Because honestly, talking about anti-aging, about nice skin.
Yeah, that's so good.
Nice, and how good you could feel, how much energy you could have.
Love it. Yes, that's all. My purpose here is to improve how I age. So
yeah.
Yeah, so good. Well, thank you so much for information. We'll put all the links in the show notes and get people to take care of themselves.
Thanks for listening to the Fit and Healthy Athlete Podcast.
Coach Debbie Potts draws from decades of experience. Ready to optimize your health? Visit www.debbiepotts.net for a discovery call. Find her on YouTube, Instagram, and Facebook at Coach Debbie Potts. To support the show, like, rate, and review. See you next time.